Welcome back to our Midday Makeover. Today I'm joined here with Dr. Geneva Ballard from Guthrie. Thanks so much for coming in.
Thanks for having me.
Of course. And as we know, October is Breast Cancer Awareness Month, and so today we're going to be talking about mammograms. For anybody out there who doesn't know, what exactly is a mammogram?
So a mammogram uses X-ray technology to create a very high-resolution image of the structures and the tissues inside of the breast. That allows a breast imaging radiologist, such as myself, to review that image and look for very subtle, sometimes changes from year to year, or suspicious abnormalities in the tissue that might signal that an early malignant process is starting.
Okay. And at what age do you recommend that women are getting mammograms?
So we recommend beginning annual screening mammography at age 40 and continuing every year as long as a woman remains in good health. And that is in keeping with the recommendations from the American College of Radiology and Society for Breast Imaging. That schedule really gives us the best chance at finding breast cancer early, and it results in the most lives saved from breast cancer.
And is there any exceptions to that rule, getting it earlier than age 40?
So some patients who have very strong family histories of breast cancer, those patients often have a first-degree relative, so a mother or a sister with a young breast cancer diagnosis, often younger than age 50. And in those patients, we would recommend beginning annual screening mammography 10 years younger than their relative's diagnosis. So say if your mom was diagnosed at 45, we would start screening that patient at 35. Many of those high-risk patients are patients with familial breast cancer syndromes would also probably need to be screened with MRI in addition to mammography.
Okay. And then once you get on that timeline, of getting mammograms, how often are you supposed to go and get them?
So for the general population who's at average risk for breast cancer, we would recommend annual mammography, so every year. It's best to just pick a date and remember that you go every year on that date. It's the easiest way to keep, yourself coming every year.
And then Dr. Ballard, for anybody who's nervous, about getting a mammogram or fears of the pain, can you kind of touch on that a little bit or ease some minds?
Sure. So, a patient coming for their first mammogram, it's absolutely normal to feel anxious or to feel, concerned about how is this going to go? Is it going to be uncomfortable? What if they find something? And these fears are absolutely just part of being human. So we recognize that, we know that. Breast imaging technologists and those of us who work with breast mammography every day realize that patients are going to come in feeling that way. And we do our absolute best to put patients at ease, to sort of walk them through the process, to explain what we're doing at each step of the exam so that patients are, can have their fears alleviated along the way. The other thing that we offer at the breast imaging centers in the Guthrie system is the ability for patients to get their results real time. So you get your mammogram, you have a nice cup of hot tea in the waiting room. The radiologist reviews your imaging at the time of your exam, and we give you the results that very same day. So that can really decrease the anxiety related to waiting for your result.
Great. Well, thank you so much. And as always, we'll put all of this information on our website, WENY.com, and locations that you can get a mammogram.